So, how do you like so far our event? Is it
Great.
good?
Great. Thank you for organizing it.
Wonderful. I like that you like it. And now we're going back to medical imaging. Yesterday was medical imaging day, almost. And I think this is a wonderful lab that has lots of brilliant speakers. Definitely lots of cause called engagement, right? Our SFU loves this word, engage the world. And obviously these videos will be posted online, so you can send it to your mom or dad. They will see you and appreciate your hard work. Okay. I guess no need to screw it out, but okay. Just come when you're ready to start. Okay, so let's welcome our fifth speaker, Mengliu. And wonderful. Yay. And please present yourself better. Tell about your work.
Thank you very much. Hello, everybody. My name is Mengliu Zhao, and I'm from Medical Image Analysis Laboratory. I'm working with Dr. Ghassan Hamarni. And today my topic is vascular structures in medical image analysis. So the first question comes, why we do vascular images? I'll give you a few astonishing facts. The first one is cardiovascular diseases have led to the largest proportion, almost 50% of non-communicable deaths in the world, due to WHO 2012 report. Again, from WHO estimation that by the year 2030, more than 23 million people will die annually from cardiovascular diseases. And the number is quite large, but how large is that? I'll give you another number. The population in Canada in 2011 is around 34 million. And the third fact is pulmonary nodules turn up in about 1 of every 500 chest x-rays, and 30% of them will turn out to be cancerous. The fact is given by the University of Rochester, and the thing about cancerous diseases is that the earlier you detect it, the more higher probability you'll be cured. And also, liver cancer is one of the fastest rising of all cancers in Canada, but has a very poor prognosis with a 5-year relative survival rate of only 20%. It is given by this year, the Canadian Cancer Statistics. So what we want to contribute as researchers in medical image analysis, we want to facilitate diagnosis, for example, in the pulmonary nodules detection, and also in liver cancer. Before the doctor give you a surgery, it's very important that we do a surgery planning to find out where are the important vessels, so that doctors will not cut the important vessels in the liver. The outline of today's talk. So first we'll talk about the modalities, anatomical structures, and some of the challenges. And then we'll go deeper down into the methodologies, which might be PDE-based and machine learning, also geometric modeling. And in the last, I'll present some of the projects and softwares in MioLab that has done by other students and still going on. Yeah, great. So for the modalities, the modality here, is the methods we get the images. I'm sorry, it might not be very clear. So one of the most common modalities is the CTA, which is short for computed tomography angiography. That is when you go to the hospital, the doctor will give you an X-ray scan. The angiography means that the doctor will inject some of the contrast agent in your vessel, in your blood vessels. A slight variation of the CTA is the ECG-gated CTA, which is a 4D image, while 3 of the axes will be the spatial axis, while 1 of the axes will be temporal, which is time-based. And another variation is the rotational angiography, which is quite similar to the CTA. And an interesting methodology is the intravascular ultrasound, we see that is very different from the CTA images and will give us a lot of new challenges. actually the blood vessels in human bodies can be fallen into different categories. For example, the carotid vascular, that is the blood vessel around your neck. The coronary, which is the blood vessel that is living on the surface of your heart. I think this is an image of the brain that you can see the vessels in it. And in the lung, we have two kinds of blood vessel structures. One is the vessel tree, one is the airway tree. And this is an interesting figure about a CT scan tumor. Tumor is kind of more like a mutated kind of tissue in human body. In human body tissue, we have blood vessels, and again, in tumors, we also have blood vessels. This is a retina, the blood vessel in the eye, which is scanned by some kind of optical instrument. Okay, so we have so many modalities and also anatomical structures. So here comes the challenges. From the modality, the ECG-gated CTA, then we see the 4D images. Since it is a 4D image, there might be 4D registration. Registration, we have talked about it yesterday, that is some alignment between the images. And the intravascular ultrasound, which is a very different kind of 3D image with short axis view and longitude view. And also, because it is ultrasound, the greatest challenge in ultrasound images is the speckle noise, which is very hard to remove and has a lot of impact on your segmentation and diagnosis. From the challenges from anatomical structure point of view is, for example, the tree structures in your lung, how you define a tree structure image and how you segment it, and also how you segment the large vessels like the aortas. And another different structure is airways. Different from vessels. Vessels, because they have contrast agents inside, so they're solid objects, but airways, they're shallow inside. And again, the tumor, from my personal point of view, it has no certain structure. It seems the vessels are not of certain shape and they're kind of intertwined, so made it a little kind of difficult to segment and analyze. Also, for the coronary vessels, they're living on the surface of the heart. So, is it possible that we combine this prior information into our segmentation and analysis? So, we can actually look at the challenges in another perspective, which I personally like. That we can build up a pyramid of our challenges. I categorize them into three layers. The most fundamental is the pre-processing and processing, which is diffusion, like we remove the noise in the image, and also segmentation, that we get the clean image. After we get the clean image, then we have to measure, we have to do the analysis, like we detect how many numbers of vessel branches there are, the total length, the radius of the vessels, and extract the center line, and detect the place of the bifurcations, find the nodules in the lung, find the tumors in your brain and liver, and also simulation of the blood dynamics in the vessels, as find the distensibility, which is a shape variation in the blood vessel, and help use this information in the surgery plan. And above all these, I think the ultimate goal perhaps lies in how the machines, not the humans, to understand these images. I think the ultimate goal is something artificial intelligence related. That can we one day do diagnosis and surgery by the machines? If you are a science fiction movie fan or an alien movie fan, perhaps you will remember that by last year's movie, The Prometheus, that it has a fantasy that in the next 50 years, we'll have a machine model called the MedPod 720i, which in their description we have it can diagnose, treat, and perform a range of surgical procedures with ultra-fine laser incisions guided by 3D anatomical scanning, all automatically. So now let's go a little deeper down into the methodologies we are using and we might be using. The very basic core concept is the multi-scale base station, which is quite simple that the original image that we convoluted, we convolute the original image with a second order derivative Gaussian kernel. For 3D images, the output of the Hessian is a 3x3 matrix. This matrix has a very interesting characteristic that if we find the eigenvalues and eigenvessels of this matrix, that if the image is vessel-like, the eigenvalues will have such characteristics that one is very close to 0 and the other two will be much lesser than 0. We can see through an illustration here that this is a blood vessel in your liver, and the yellow circle, I wonder if you can see it clearly, it is on the sectional plane of the vessel. That here we can see that the two eigenvalues, lambda 2 and lambda 3, which are much lesser than 0, their corresponding eigenvectors expand the cross-sectional plane, while the lambda 1, which is very close to 0, it is the corresponding eigenvector point along the vessel direction, which totally makes sense. If you imagine a vessel is a tube that has a certain direction, and it has a high intensity inside while very low intensity at the background, then if you follow this direction of the vessel, it will have very few variation. That means the eigenvalue is close to 0. Well, you go from the center of the vessel to the background area, then you have then the intensity will go from a very high level to drop down drastically. That means the two corresponding eigenvalues will be much lesser than 0. Some of the methods we have investigated are PDE based. We investigate the PDE in diffusion model and segmentation model. The diffusion model could be followed in two parts. One is isotropic, which is more like a heat equation that diffuse equally on all directions. But one special idea, but another kind of diffusion model is anisotropic. For example, we have a vessel enhancement diffusion model that diffuse only on the possible vessel direction, but it will limit the diffusion that is perpendicular to the vessel direction. Also, on the segmentation model, in general, PDE-based segmentation model, it can be divided into two categories. One is Mengliu model, which makes the assumption that the image is piecewise constant and piecewise smooth, which is not very suitable to our vascular images. And another is active contour-based, active contour model, which is more gradient-based. And here we give an example that we use active contour model to do vessel image segmentation. And another important thing in PDE-based image processing models, very important technique is the level set technique that embed a curve on the plane to a sight distance function in 3D space. Another methodology we think might be useful and very prospective in medical image analysis is the machine learning-based methods. Machine learning, for example, the decision forest methods. The challenges here is for especially for 3D vascular images, the training data is very little because it's very hard to find a clinical doctor or expert to extract manually like the vessel trees because they're so complicated, it gives them so much work to do. So the training data is very limited. And another thing is how to find a good feature or many good features that will perform very well to multiple data sets, or even if they can perform well to a single special data set. And here we give a few examples that the community of medical image analysis around the whole world, what they are using machine learning to do vascular image related analysis. One thing is they try to classify the they try to classify the bifurcations. And another thing is they try to detect the pulmonary chunks. And one interesting thing they're doing is there are some, in the lung, there are some vascularized pulmonary nodules that they're also using machine learning-based methods to do that. And this is what we are doing now with Puya Bastani. I'm sorry, he's not here today. We are trying to look at the geometric modeling of bifurcations. Here, for example, this is a try to model a bifurcation in purely mathematical equations. And here's the above is a figure that is generated by this mathematical models. And the future problem lies how do we use this model in real image analysis and segmentation and analysis. So perhaps we can do fitting, but then if we do the fitting, then the problem becomes how to do the optimization, because we have like millions of voxels in the volume image. Then I'll spend 1 minute on the software and the projects going on in real lab. One software is designed by MLA, that is MRF-based 2D vessel scale selection. And one software is the Live Vessel, which is 2D semi-automatic segmentation software. This is an algorithm, the image crawler, which is doing segmentation and analysis on 2D and 3D vessel or spinal cord images. And this is a 3D vascular tree synthesized software. And also in this spring, we put up like 120 volume images synthesized by this software on our website. So to make a conclusion, today we talked about basic challenges and also modalities in vascular medical image analysis. I would like to use a phrase used yesterday by Heng Anmei, my colleague student in our lab, that the field of medical image analysis is a combination of mathematics, physics, computing science, imaging, and medicine, and perhaps many more nature science disciplines. And to me, the medical image analysis research is interesting, is inspirational, is full of challenges and opportunities. But the most important of all, we researchers believe that our work and our effort is helping the doctors all over the world to save millions of lives. Thank you very much.
Brilliant presentation, in my opinion.
Yeah, that's right.
And we would like to have a question from the audience.
You said you are using there are different types of medical images, and the CTA and rotational CTA. What kind of images are you using in your lab? Are you using the state-of-the-art technology?
Different students work in different projects, so their data resources are kind of different. I am working on vascular images, and my data set are mostly downloaded from different websites that are available from different researchers. So they are mainly, I think they are mainly CTA images.
And can you give us a number about how large is your databases? I think there are not so many CDA images around the world, and let alone having them being annotated.
For example, this liver is, I remember, is 300, something like 300 by 3 or by 500 or by 80, like on X, Y, Z dimension. And the vessel tree images we downloaded from a research group data set that is for each volume that is 512 cubic.
So your databases are not so large.
I'm sorry?
Your databases are not so large. You have a limited number of pictures.
You mean for
because
each
in our
volume?
work, we are working on more than we are working on tens of thousands videos and images in our lab. But I think we are just working on hundreds of images. And is that enough?
I'm sorry, I don't think I quite get your question. You mean how many numbers of volumes in the data set, or how large is each volume?
No, how many types of, like you're working with some medical images?
Yes.
How many images you have? Thousands, millions, thousands?
You mean how many examples I have?
Yes,
exactly.
Yes.
Wow, we perhaps for each data set we got only 20 or 30. It is very limited. So that's why I'm saying, for example, we are very lack of training data.
So basically you need better communication with medical institutions, so they would give you
Yeah,
this
definitely.
data.
Yeah.
Okay.
Exactly. That's
Yeah.
the question.
Seems like a bigger problem in medical industry that, you know, they have this data but they don't want to share it because of privacy.
Yes,
and they want
privacy.
money probably for it,
Yeah.
but they could save lives. Okay, let's thank our speaker. And, so we have last speaker of day 2. It's Rohit from Natural Language Processing Lab. So take the stage, prepare.